Well, other than skin cancer, prostate cancer is the most common cancer in American men. Joining me to discuss more about this is Dr. Francisco Helpe with Houston Metro Urology. Doctor, thanks so much for waking up with us.
Thank you so much for the opportunity. Glad to be of assistance.
So we've talked about how common it is. What do we do as far as treatment?
So there's a number of avenues that patients can elect. Conventionally, we have consider surgery as kind of one of the most traditional routes, but the reality is we have a good number of men that don't need active treatment per se, as long as the cancer is not that aggressive to begin with. And then on another box, we do have patients that end up going down the radiation route. Again, a lot of this has to do with the particularities of a gentleman's cancer. And then, you know, that with the discussion that you end up having with your doctor should set the stage for how do we move forward.
And side effects, though, I know that that's a big thing.
So side effects are a very common theme when it comes to treatment. With surgery, the conventional side effect is erectile dysfunction. That's one of the reasons why a lot of men tend to steer away from it, which then puts us in the radiation therapy sort of like stratosphere. For a really long time, one of the most common side effects that we had dealt with was irritation to nearby structures, because the prostate happens to sit in a place where it's very close to your bladder and your rectum. The bladder part was addressed by making sure that patients keep their bladders full when they come in for the treatments, but really did not have that many options for the rectum. And that's how we come up with this, this gel called Spacor. It kind of provides a buffer zone between the prostate and the rectum. And the end result has been that patients actually tolerate the procedure way better, and then they don't have to deal with the complications down the road.
Oh, that's amazing. I've never heard of that before. So what do you suggest men do?
So the idea is any gentleman between the ages of 50 and 70 should get screened, and particularly men that have a strong family history of prostate cancer. We do have tools nowadays to screen. We do a rectal examination, and we do a blood work, which is called a PSA, prostate-specific antigen. And the idea is at least once a year, come in, check that box, make sure that you are at least keeping an eye on things, so that if we are dealing with something that needs to be treated, then we already, we are being proactive as opposed to reactive.
Because it can be treated, that's the thing.
Correct. Highly curable disease. It's a very slow progressing disease as well. But every now and then we do have gentlemen that have more aggressive cancers, and then that's when we need to start being a little more proactive as opposed to reactive.
Well, doctor, how can people reach out to you and set up an appointment?
So if that's the case, our phone number is 713-634-4441.
All right, doctor. Well, thank you so much. It was a pleasure having you on the show.
Appreciate the time.